What's up, everybody? Welcome to another episode of Puzzle Huddle with Experts. I have another fantastic guest. Her name is Freeman. She's a speech language pathologist, and she's the mother of an autistic child. Now, I'm developing in me a huge passion around different categories of diversity. I want to learn. I want to learn how to create space. I want to learn how to advocate. I want to learn how to build tools to help all of the different components of our community. So this is a journey that I'm on, and I'm glad that the audience can come on this journey with me. So good morning, Catherine. How are you today?
Good morning, Matthew. I am doing well. How about yourself?
I'm wonderful. So just as the point of entry here, you have three children. How did you learn that one of your children was autistic?
Yes, so I have two boys and a girl. And then as a speech pathologist working in the field, I've been working around children with various disabilities. So I was aware of the signs and symptoms of autism, even though, as a parent, I kind of took myself out of the speech pathologist role and more so as a mother, because that's what she sees me as a mom. So I was like, went to the doctor and I was like, well, she's not doing this. Like she wasn't crawling correctly. She was doing more so an army crawl. And the doctor was just like, oh, that's okay. Some kids tend to do the army crawl. We'll continue to monitor her. So I was like, okay. And then so the next thing was her walking. She didn't start walking until around 14 months, which, some kids normally walk a little later. But when she started walking, she was walking on her toes. So she was told. So I automatically knew that was a sensory issue, something sensory was going on. So I brought it back to my pediatrician again, and the same thing, some kids go through that. And eventually she did stop. And so I was like, I'll continue to watch. But then the big red flag came in was with her not pointing to things, and then with her gestures, like when you would say, we'll say bye-bye. And most babies they'll say bye-bye and wave, and she would never do any gestures such as waving. So that was my big indicator. Okay, there's more going on with Kinsley.
Like, how did you, most parents go through a journey where we're really watching our kids, but thank goodness you had the professional background to spot some of these things. But many of us are, assessing it. We're assessing genius in our kids. We're assessing, we're just paying. So, and I think the internet helps us to kind of just brainstorm different things to associate our kids with. Like what gave you was it just your professional background was enough to kind of set that foundation?
Yes, it was. And then, when they say when you have kids, don't compare your kids to your other kids. And I was kind of doing that, and I was like, okay, well, let's give her some time, because he flew through milestones, ahead of time. So it's like, okay, he was a little faster, so maybe she's just a little, delayed in her milestones. But having that professional background as a speech pathologist really helped out.
Yeah, thinking back to when I had like infants and all the things you're monitoring. It's like swallowing whole foods, holding things with their hand, being able to lift their head and neck up, being able to crawl, and just all the different little tiny things that you're really celebrating as a parent. And if you don't hit one of those milestones, right, it's, there's a whole life here. So, to get over passionate about a specific thing, you might miss the broader picture. But thank goodness you had the professional background to kind of key in on a specific thing, and then taking it. At what point did you go to an expert to see if what you were observing might be something of significance?
I actually, since I work in the school and I work in special education as a speech path, we see our kids that come in from early intervention from birth to 3. And so I had worked actually in early intervention before I came to the school district. So I contacted the ECI specialist over there, and I was like, hey, my daughter's, she's not meeting certain milestones. I want to have her looked at. And then that's how we proceeded with that.
Yeah, not to put you in the seat of being an autism expert at this point, but what other things might a parent observe that can be associated with autism? You mentioned, walking on toes, the style of crawling, and hand gestures. What are some other things that are just classic that early developmental observations that are associated with autism?
Right, yeah. So specifically with autism, they have impairment in communication, impairment in social interaction, and then also behaviors. A lot of our kiddos, they have repetitive behaviors. Also with my child, she was flapping, which is stimming. So she was doing a lot of stimming. Like if she was overly excited, and so that was another big one that I noticed with her. The stimming, and then for some reason with her, she would sensory where she would start pulling out her hair, and we'd wake up in the morning and there was patches of hair all over her crib, and I'm like, oh my god, what is this? And the doctor's like, oh, it's a what I forgot to call it, tricha something with the hair when they were pulling it. And I was like, that's a sensory issue. And so we had to go through hoops with trying get her to stop doing that. So that was another sign that some sensory was not, something wasn't connecting. So that was another sign for her. And then also a lot of kids with autism or autistic children, they'll get focused on one exact thing. Like with her, it was Mickey Mouse. She would watch Mickey Mouse over and over and over, not which on something else. It would not gain her attention. So they have those fixed interests. I know a lot of boys, they tend to do the trains, Thomas the trains,
Yeah,
or
yeah.
they'll line up. That's another thing. They like to line up things, like they'll line up all their cars, or they'll line up their trains, or even with colors. My daughter, her thing was with colors. She would associate everything by colors, and if she had like pieces, she would put all the red ones over here, she put all the blue ones over here, instead of playing with them appropriately. That was her thing, of focusing on lining and sorting.
All right. So I believe in parenthood, there we pull from lots of things from our childhood that help us inform our decisions and capabilities as parents. What can you tell me about your childhood? How might your childhood have prepared you for this opportunity to be the parent of an autistic child?
I don't know. I don't know. You have to have a lot of resilience and patience, being the parent of an autistic child. But my childhood, I was adopted and raised by my grandparents, so they were older.
Did not know that.
So we kind of they adopted my brother and I, so it was kind of just us two, and we just played together, and we knew that we had to support each other, and because we didn't really have you know we had cousins, but not um let's see how to say it. Sisters were older, like a disconnect,
Yeah.
between the parenting and the child. So we kind of had like aunts that kind of stepped into and
Right.
helped us as well. So I don't know. I know I like being consistent as a child, and so I did a lot of things in order. So kind of like Kinsley, I had to have that strict routine of doing things my way and not doing things my brother's way.
Yeah, I think for all of us, being a child, we'll observe some things that we want to replicate for our children, and then we'll probably also observe some things that we don't want to replicate, things that we want to avoid. So that you have to enter into parenthood from somewhere,
Yeah.
and likely your childhood is a big portion of what feeds your parenting decisions. Something that I ask every guest: what were some of your favorite childhood toys?
My favorite toy was the Easy Bake Oven. And then they also came out with I don't know if you know, but they had a McDonald's one where you can make fries and
I did not know
burgers.
that.
So that
Yeah.
was one of my favorites. They had a McDonald's toy that was similar to the Easy Bake Oven. So I had both of them.
Okay, I don't know how much those are running from now, but on the antique market, or the eBays, or I'm sure a McDonald's branded Easy Bake Oven might be a real find in the vintage store market. So you professionally, you're a speech language pathologist. Can you describe what you do in that capacity?
Yes. So as a speech path, I work with children with various disabilities. We have children with Down syndrome, cerebral palsy, autism, even just your typical speech delay. We have children that are just delayed in their milestones. There is not any other condition going on with them, but we work with them on different concepts, such such as articulation, working on their speech intelligibility. And then a lot of things, when people hear a speech pathologist, they just think that we work on speech sounds, but we actually work on things more speech. We work on language, receptive and expressive language, on comprehension. We work on semantics and syntax. We work on pragmatics, and pragmatics is with their social skills. We also work with swallowing and feeding. And then we also work with voice and stuttering as well. So we have a broad scope of practice. I'm in the school district currently right now, so a lot of my kids are articulation, language, comprehension, fluency. That's the bulk of my caseload. And then, of course, I have a lot of children in the structured learning class. That's with the autism. Our students are in the structured learning class. And then also for any parents that have a child from birth to 3, they can receive ECI services. That's early childhood intervention. And then once they age out at 3, that's when ECI refers them to the school district. And then once the school district, that program is called Early Childhood Special Education, and they can start that program at 3 years old. So if any parents are looking for what to do with their children that has a disability.
So what was going on in your life in terms of experiences and interests that set you on the path to become a speech language pathologist? Like what are the key influences that loaded you up with that interest?
Actually, I started out as a nurse. So I am a nurse, actually. So I started in nursing, and then when I was going through, I believe, my RN rotation, my clinicals during the hospital, I actually went into the speech pathology section of the hospital and watching them doing the modified swallows. And so that piqued my interest. And the clinician that was working, she was like, she started telling me more about speech, and we can work in various settings. And I was like, oh, I'll look into this, because I've always teaching, but I didn't really want to be a teacher. And so I liked nursing, but like all the evasiveness of it. So I was like, here's a happy medium here. I can do speech pathology and still have a little medical side, and then also have the teaching side. So that's how I got speech.
All right. And when you're engaging your clients in speech language pathology interventions or support, is it usually one-on-one or in groups, or how is that service provided, or assessment, or whatever interaction that you have with those patients?
Yeah, so we do the evaluations. The evaluations are one-on-one. You can do speech therapy sessions one-on-one, or you could do group settings. If that child is appropriate to be placed in a group setting, we'll do group settings also. So no more than 2 to 3 kids in a group.
What do you do when children are having a speech and language issue? It likely affects their confidence and self-esteem. So while you're helping them deal with their vocal challenges, how do you also support the confidence and self-esteem that they'll need along the way, and just in case their speech and language challenges are diminishing their confidence? Like how do you give them that dose of awesomeness while you're helping them with the physical challenge?
And that's a big thing, because when we're in the speech room, more so in small group, one-on-one, it's a lot of and a lot of support. And then, of course, when we go out the room, we want those skills to generalize in the next setting. And then a lot of times our kids, once they walk out of the speech room, everything goes out the window. It's like, okay, wait, what did we just work on? We worked on this. So we'll do like little exercises. Okay, we worked on this in speech, asking questions or answering questions. Okay, let's go outside and make a friend and use those skills that we learned and meet some new friends, because a lot of our kids, like you said, their self-esteem goes down, especially when they know that they are in speech in the school setting. They do not like to see speech therapists coming to get them for speech. And so we do a lot of rewarding and a lot of confidence boosters. You're doing a great job. Those sounds sound great. I hear a lot of improvement. I want you to keep that up. Did you hear that? And I'm, yes, see, you're doing it. And then that helps with their self-esteem, especially with giving them rewards. They love that.
Yeah. my discussion with you is leading me on a different path than I was going to be with my written questions. But with autism and speech and language issues as a coping mechanism, many kids are going to learn how to want to mask themselves or be invisible. Like that's just not to appear in the environment, so they don't have to have interactions and risk embarrassment if they come across a specific way. So
Right.
helping, what can we encourage all kids to do to make these spaces and places much more accepting and patient and open for kids with all kind of abilities, so that nobody has to be invisible and everybody can show up with the skills and the physicality that they have,
Yeah.
and be effective interacting with all. Like what can I teach my kids to do to
Right.
be
Yeah.
more inclusive?
And then also a lot of our kids with communication issues, their way of communicating through behavior. So you'll see as behaviors are out as a result of them the inability to communicate their wants and needs. So we try to give them a lot of visual supports, a lot of okay, if then situations. If you do this, then you should do this. Or first, first we in this. So more so like a visual schedule for our children with autism. So if they have that visual support and that visual schedule, it decreases those behaviors of them acting out and wanting certain attention because they know, okay, this is exactly what I have to do and this is my schedule. But as far as like even with my neurotypical children, when they see my daughter with her behaviors, they know, okay, let's give her some time to cool down, 5 minutes, leave her alone. Don't say anything, don't touch her because it'll set her off. So kind of just giving them that cool down time and then letting the other ones know, hey, and we do a lot of educating with our neurotypical. Okay, this is what autism is, or any disability. This is what these disabilities are, and these are some of the things that you might see, and this is why they are acting that way. And then y'all just go on about your day. It's a normal situation. They're used to it now, so they're like, oh,
What are some of
having
your
a moment.
daughter's favorite activities?
Oh, she likes jumping, so she will jump all day, every day. She likes to jump on the tree, in the bed, of course. That was another thing that I was looking for her an adaptive gymnastics area, but we didn't have a place that provides, those accommodations that she would need. Um, so I was looking for that for her to jump. So I'm still kind of looking for it, tumbling because she likes to do her tumbling.
Yeah.
So she likes to jump.
And then another social opportunity is what have you done to help your daughter make friends? I understand in child, some kids make friends naturally very easily, and then some kids don't. And then when you layer in, autism, ADHD, a speech issue, that's going to make it potentially more challenging to make friends. How are you able to help your daughter, find and identify, childhood friends for the value they can provide as peers and playmates, and people to just run around and jump on the trampoline with, or whatever activity.
Right. Yeah. So with children with autism, the autism spectrum is very wide. We have our children that are highly verbal, and then we have our children that barely speaks or that are non-speaking. So with my daughter, she says some things every now and then. She's not consistent. She'll say yes, no, mama, daddy. I work with and I do sign language with her, and she's finally coming around. Like if she wants more or she wants something to eat, she'll do some basic signs. And then also I have as a speech pathologist, I knew that, okay, she's having trouble communicating. I need to get her a communication device. So she also has an augmented and alternative communication device for her to communicate. So like the other day we were outside playing and she loves water. That's another thing. Children with autism or autistic children, they are drawn to water. So
Yeah.
parents keep eyes on children with autism because they will wander off. But she loves her water. And so the neighbors, they had those big water slide things up. And so they're like, hey, come over. And the little girl, she's like second grade or first grade. She's like right under my daughter. My daughter's 7. And so she came over to Kinsley and she was like, "Hey, do you want to play?" And of course, Kinsley was, not saying anything. She was just looking like, huh? And so the little girl asked her again, and I was like, Kinsley, look at her. And I was like, this is a good opportunity for Kinsley to, say something or, do a gesture. And of course she didn't. So my son, he's 6 now. And so they're right, they're close together. And he's like, "Mom, the neighbor asked Kinsley if she wants to go." I was like, "Okay, Ken, go tell her yes, and we'll go over there." And the little girl is 2 little girls actually. And it was just like, it warmed my heart that they came over, invited, Kinsley to come and play over there, even though she didn't realize. They were still like, "Come on, let's go play." And so when she went over there, they're like, "Do you want to get in?" And Kinsley, she'll shake her head now. She'll like, and it was, they didn't force her or anything. They kept going about their business. And then they came back again. "You want to play with this?" So they kept, engaging with her. And so they never asked what's wrong with her or why isn't she talking. So that warmed my heart as a parent.
When you're observing these things, like how excited, how is your heart fluttering, or just are you nervous? Are you excited? Are you like what? As you're observing this, what's your emotional experience as you're watching this scene play out?
Yes. So I was looking. Kinsley, you never know. So she didn't have anything in her hand. And so I'm always like on guard, because if she had something in her hand, she probably would have hit the little girl, get away from me. But she actually, and so that made me very proud. And that Kinsley, she's understanding that, she do not people. So that just made me very, very proud. But on other times I might be on edge if she's like not in a good mood.
Yeah.
She might push another kid, but she had a great day that day.
What is some of your daughter's favorite subjects in school? What does she love to learn about?
She likes, I would say, she's just now getting into her attention. Autistic kids, their attention span is very, very short. She's just getting to the point where she is focusing and attending to tasks. So anything sensory, anything that she can touch,
Okay.
like anything like when they're learning in math with the numbers, like any magnetic numbers or with the spelling, magnetic letters, she loves that. That's like her favorite thing. Anything with like ELAR, but it has to be tactile. Because if it's not tactile, she's not interested at all.
Oh, wow. Have there been any breakthrough moments where there was a capability or skill set that she didn't have, and then through some support or intervention or coaching that you identified her doing something that she previously hadn't been doing before, and it was just like a breakthrough moment where you observed her do something really cool?
Oh yeah. Let's go back. So the whole potty training situation, that is tough for, it's tough for your neurotypical children. So imagine an autistic child, and then it's a sensory issue too. So a lot of our children on the spectrum, they will smear poop all over the wall. Poop smearing, yes. So we had to deal with that for a long time. And it was very, my husband and I, we had just moved into our new home, and she smeared poop all over the walls. So that was a big breakthrough when she stopped doing that, and she was able to be potty trained. So now she's toilet trained. We don't have to deal with all of that. But that was every night, every situation that we had to deal with. Yeah. And then to stop that, we kind of did a lot of sensory, like giving her Play-Doh, putting her clothes on backwards, or putting something around her waist so she wouldn't get into that, to smear the feces. But yeah, that was a big breakthrough. And then also with her signs, I have been teaching her, eat, drink, more, the basic signs. Yeah. Like over and over. Our kids need repetition, so we were doing that over and over. And then one day she was out of the blue. She was like, she wanted more or something. I was like, "Yay, you did it! I've been doing this for so long, and you finally."
And it finally clicked.
Yes.
So what do you do as a parent? All parents need a break. You know, parenthood requires a lot of energy, a lot of our emotional, physical, mental energy, and then having moments to recharge or step away. How are you able to support your own mental health while also being very engaged and present for your kids and for yourself professionally? Like what do you do to just keep your own health and well-being together?
Oh, the gym. That is my thing. I definitely have to go to the gym. I go to the gym. I try to go, well, since I'm on summer break now, I go pretty much Monday through Friday, and that is my self-care time. That is my time to myself. I'm in the zone. I'm not thinking about autism. I'm not thinking about kids. This is just me working on my well-being and releasing stress in the gym.
Because I'm a gym head, are you in there? You doing Zumba, CrossFit? What are you in there doing? Kickboxing, the lift, throwing the weights around? What kind of
Yeah,
stuff are you doing?
I'm doing the weights. I'm throwing the weights around. I do a little cardio, but I like to hit the weights also.
All right. Now, resources for autistic kids or community or programs. What have you found have been some of the most effective things that you've been able to connect your family with, your daughter with, that have provided value for her development?
Yeah, you know what? I said I am blessed. I mean, that's probably why, not when you look back, you're like, okay, why did I change? Everyone's like, why did you change from nursing to speech? But I'm like, it was a preparation moment. God put me there to be a speech path to work with my daughter. So, that's like, oh, okay, So I had the tools,
Uh-huh.
I had the tools and resources to be able to help my daughter and work with my daughter as a speech path. Now, for instance, if I was just a parent that didn't have that background, I wouldn't have known what to do. I would have been Googling, which I still Google, but they have Autism Speaks, which some people prefer not to
Yeah.
support Autism Speaks, but word of mouth, from other parents that are in the same situation, support groups, that has been helpful with getting information and learning. And then also what we're working on with Connect, we are working on putting information and resources available for our parents with autism and various disabilities also. So it's about letting parents know the services that are out there, and then the places and accommodations that are available for our children with special needs, because a lot of the things that typical parents go through, um, we experience on a different level. Like, we have to do a sedation just for her dental visit because
Oh,
it
wow. Because
can't tolerate it. Yeah. So that's another issue. Oh my God, the insurance only pays a little bit. So yeah, just to do her cleaning and all that, we have to pay to get
for
that done.
sedation, just okay. My daughter went to the orthodontist today to go through the preparation stage to get braces. It wasn't, she didn't have a fun going through. So if she had a sensory issue,
Uh-huh.
gosh,
Yeah.
it would have
Yeah.
been compounded just, to an extreme.
Mm-hmm.
Wow.
And
Well,
even with hairstylists, especially for the boys on the spectrum,
yeah.
they have great difficulty getting their hair cut.
Yeah, I've seen a couple cool Instagram videos of different barbers working
Uh-huh.
with a different sensory and how to sneak or play a game
Yeah.
or dance in a way to help. All right, how do you think through? Most parents will try to, when our kids are young, we try to prepare the way for our child. So, how do you consider how much information to provide to other parents, friends, strangers, people that you're engaging with about your child's autism, or do you make a conscious decision that you don't share? Like, how do you decide, like, who gets to know and why they need to know?
Right. Yeah. Well, strangers, no, but even like the neighbors, I never disclosed, hey, she's autistic. So more so the people that, like, of course, my mother-in-law, the grandparents, the ones that are in close contact, of course. But other people, I tend not to disclose.
Yeah, and what coaching do you have for all of us that are out in the world, and we hope that we're engaging people with positivity and with positive intent, and we're having an interaction with a parent, and we might stumble and say the wrong thing, or how can strangers best, support you if they don't know that your kid's autistic, but they notice a behavior? What are some things to not say, or things that we can't say, to just be friendly and supportive, without being nosy or overstepping what might be our
That's a
business?
good one. That is a good one, because a lot of times the people outsiders are saying, "Oh, you need to whip that child," or he's being bad, or she's not listening, or you need to do better at parenting. And even if you do tell them, "Hey, they have autism," they still, "Oh, there's nothing wrong. There's nothing wrong with that. Nothing wrong with that child." And it's our community. They're just bad. So, yeah, it's not. And I think, I don't know, it's like before my daughter was diagnosed I worked as a professional. It's different. It's a totally different perspective once you're actually living it every day. And so that's a hard one. I would say just don't use terms such as "they're bad" or "they're not listening," because they are listening. They might not be able to verbally express, but they
Right.
still comprehend everything that you're saying. Um, just be supportive, have empathy, understanding. A lot of our kids, autistic kids, are destructive, very destructive. So we'll go out, we'll go to my mother-in-law and family members, but as like friends every now and then, maybe not, because destroy some stuff. We've been through like maybe six TVs. Yeah.
Oh, goodness.
So now she's like, we had just got her a TV for Christmas, my husband, and I was like, okay. So this was December, so it was broken maybe in February. So we're not buying another TV. We're not doing
Yeah.
it.
But yeah, for those of us that are observing as outside, it's really a more healthy perspective to not rush to assume. And these whoopings aren't healthy mechanisms anyway. But
Mhm.
not to say that child needs a spanking or what. Like
Right.
there could be a lot more going on.
Right. And then when you see them, outsiders looking in and say, "Oh, they're having a tantrum." In reality, it's not a tantrum, it's a meltdown. They're having a meltdown because something sensory is going on. Maybe the lights are too bright, or it's too loud. So just be aware of those type of sensory issues that might lead to a meltdown where the kid is acting out. It's not a tantrum. It's not because they're not getting their way. It's because it's due to sensory issues.
Yeah, they may very well be like this. They're going through a whole experience that is way more complex than the 30 seconds that a person just observed.
Right.
Tell me about this wonderful business that you have, Alt Connect. What the mission is, what the activities are, what is Alt Connect, and what are you guys building?
Yeah, so we are building Autism Connect. We are currently rebranding, but we still have the same mission. And so iConnect is a platform for parents and caregivers of children with autism and special needs to connect, to find qualified service providers and accommodate in places, and also to receive that community support and then education as well. So as speech pathologists, we provide speech therapy services. And then we also, for our local community, we put on sensory friendly events. And that is where, we find a place that is sensory appropriate, where they have they turn down the lights, they turn down the music. So it's very, welcoming, and it's not overwhelming for our children with autism or on the spectrum. So we do different events like that in our community. With COVID, COVID happened. So a lot of places are just getting back in the swing of doing different events and things. So we're looking forward to put on more events and doing things for our local community.
Now that you mentioned that, I remember a classic birthday solution when I was growing up was this trip to Chuck E. Cheese, which arcade, ball pit, lot
Mhm.
just and depending on the child's tolerance for sensory, just might not be a great environment for them to have their birthday. It just may be too many things.
Right.
So what were some other things that you were looking for as the parent of an autistic child that you had a hard time finding?
Like for her, I tend to do everything based on her interests. Like she likes to to jump. So she loves the track parks. So we'll go to urban air or anything that has to do
all
with
the way
jumping.
loose, like go kid, go.
Yeah. Yeah, because Chucky, like of course, her siblings like to do other things, and we'll go to Chuck E. Cheese, and she is not into Chuck E. Cheese. She wants to jump off the machines at Chuck E. Cheese and not play with them. So I was like, no, we're not coming back to Chuck E. Cheese.
Thank goodness. I'm sure in the mix of this, there are probably some moments of just like a decision that she made to just bring so much joy and energy to a place that they weren't expecting that to happen.
Yes.
And it can just give you a relief that, wow, this kid is something.
Yes. So I'm like, get down. No, you did not jump here. You play. So a lot of modeling with her, like a lot of with Kinsley. And you think they're not listening, and they are listening. It takes time and patience, but they are comprehending. And one day it'll just come out. It's like, oh, you were listening the whole time.
All right, and maybe just one last thing that I want to ask you: where do you recommend parents and parents of autistic children and just community members to go to learn more about autism, the spectrum, some of the behaviors, how to be supported? Like, where do we go get caught up on how to help in these situations?
Yeah, like I said, they have various organizations out there now. They have Autism Speaks. They have talk about the autism community in action. That's another one. Autism Speaks. Parents, look into your local organizations if you have any nonprofits. The ARC. We have the ARC of Greater Beaumont. I know they have different ARCs in different states. That's another good resource for parents. So you like I said, a lot of Googling, a lot of research. And so that's what we are working on right now is helping, like once you get that diagnosis, you go to the doctor. Good thing I had the background, but for other parents, you go to the doctor, okay, here's your diagnosis. Your child, is autistic. Try to find some therapies or, that is a problem, because parents are having trouble accessing these services. And then they're like, okay, what do I need to do? Where do I go? Yeah, it's just a whole nother.
Yeah, and once you might layer on some code like the autistic and diverse, or autistic and female, and some of these things that might create a double or triple minority category. Yeah, finding some resolution and helping them find the best support for them with the different things that line up with their lives. Yeah, I bet that could be challenging to try to line up several things because, as I understand it, the autism population, the diagnosed autism population skews male.
Right. Yeah. And so like I say, I have a girl on the spectrum, and it's very far in between that girls are even diagnosed because they say it's easier to get misdiagnosed as a girl, or girls tend to mask those behaviors. So, yeah.
All right. This is absolutely one. The last thing I want to get from you is, what is your kid awesome at? What have you noticed that your kid is just better than what you've observed out of other kids? Like, what is she really fantastic at?
She is fantastic at helping cook. She loves to cook.
Stop it. Really?
Yeah, she does. Like every time in the kitchen, and then I play to her interests. So that's another learning opportunity for her. When we're cooking, I go through, I narrate everything, model everything. Okay, we're cutting, just to give her that language and vocabulary. So she loves to cook. She loves to get the water, put the water in the pot. She loves to cut. And so she's understanding, okay, we need to do this first before we do that. And so cooking is her thing. So I think she'll be a chef.
And there's a good chance she's really good at following steps and protocols and keeping things in order.
Mm-hmm.
So where some of us would never follow the recipe to a bad outcome, she has the methodology to go through the steps and have a successful outcome.
She's very follow the step first, with her routine. So that is her.
Catherine, this has been absolutely wonderful. I can't wait to see what you guys have coming with Alt Connect and the rebranding of it. And helping connect parents with the solutions and the programs and across, I think nationally, to help get them the resources they need to, have effective experiences, have effective support, and create the best space that they can for their children.
Yes, thank you so much, Matthew, for having us. And then if any parents are interested, they can follow us on Instagram to stay up to date on our latest developments that we're doing.
And I'll make sure to put Instagram in the notes of the YouTube show, so it'll be there for anyone to click the link.
Okay.
All right.
Thank you, Matthew.
Bye, everybody.
Bye.